In thinking about the ways we can fix healthcare, make it more affordable, more accessible, and more efficient, and make it market-based, not government-based, I've been struggling with the way we can get people to take care of themselves better, but also to reduce costs. What you have right now is you basically have a lot of experts out there saying, don't drink, don't smoke, exercise, don't eat junk food. And does it work? No. What you also have is, for people who do have good insurance, they're using more medical services, increasing the costs, and they don't see the costs, so they don't care. The Congressional Budget Office has estimated that for every 10% reduction in out-of-pocket costs, you actually see a 1 to 2% increase in the use of medical services. There are some things out there that can actually do this, encourage people to take care of their health and reduce costs. One of them is an HSA, a healthcare savings account. And an HSA, it allows you to work in conjunction with a insurance policy, okay, a qualified insurance policy, usually a high deductible policy, and you can make payroll tax-free investments or contributions to an investment account that you can make withdrawals from, again, payroll tax-free, for medical expenses, okay, qualified medical expenses. The cool thing about it is that at the end of the year, it's not use it or lose it, it rolls. It rolls to the next year and the next year and the next year until you're 65 and qualify for Medicare. And at that point, you can make withdrawals for anything, not just medical-related expenses. There's also the Safeway grocery store chain has set up a program almost a little bit like the HSA in that they put $1,000 of Safeway money into an account for each employee. What's interesting about that is that it sets up an incentive for the employee to really watch those costs for that first $1,000, because then they go into their own money. Safeway has also set up something called healthy measures, and if the employee passes a set of tests, blood pressure, weight, cholesterol, and tobacco usage, that individual gets a significant discount on their insurance product. Overall, Safeway has saved about 13%, and the employees saved 25%, which is unheard of in today's insurance market. Now, there is one negative thing I will mention, and that is that the CEO of Safeway is going around telling Congress he believes in a mandate, that everybody has to buy insurance or the IRS will come after you. Walmart has done the same thing. You know from episode 6 that I don't really appreciate that. I definitely think that mandate creep, which is where the policyholder gets stuck with all these expensive procedures that we don't use, but we can't bail. And I think that's a real possibility. And also, as you know, I have a bias for liberty.